Drug overdoses are on the rise, and Ohio leaders are trying to find ways to save lives. Good evening, everyone. I'm Ellie Merritt.
And I'm Mike Jackson. Thanks for joining us tonight. Funding is a key to making sure the first responders have what they need. NBC4's Ted Hart joins us live to explain what's being done to keep that funding. Ted?
Well, Mike, Station 17 here on the hilltop serves one of the areas of Columbus that has among the highest incidents of drug overdoses. Just this morning, Health Commissioner Teresa Long revealed that Columbus paramedics had 31 saves from overdoses this past weekend. Lieutenant Pat Miller says it's become pretty routine.
I've had them where there's been 3 or 4 people out, and we've had to give them, all 3 or 4 people, naloxone to pull them out of what they've been in.
All in one spot?
All in one spot.
Last year, Columbus first responders gave naloxone to about 2,200 patients, oftentimes multiple doses. To get an idea of what it can look like, this video is from a public transportation bus outside Philadelphia earlier this year. A man shoots up and promptly goes into distress. When medics arrive, they administer naloxone, which rapidly reverses the effects of the overdose. Columbus EMS spent $147,000 last year on naloxone. Senator Sherrod Brown has introduced legislation to make naloxone more affordable for local communities.
The government can get pretty good prices on this when it buys huge amounts of naloxone nationally, the same way the VA saves on prescription drugs by buying in quantity.
Brown's legislation would also expand access to treatment and long-term recovery, something first responders say is badly needed.
A lot of the people we go on might have been in rehab 1, 2, maybe 3 times and still can't kick it.
And naloxone is a life-saving bridge to treatment if treatment programs are available. And coming up at 6, we're going to talk to a recovering heroin addict about overdosing, about naloxone, and about treatment. Live on the hilltop, Ted Hart, NBC4.
All right, Ted, thank you. As you mentioned, Narcan or naloxone is a big part of this. It's available without a prescription in a number of pharmacies here in Central Ohio, but families are also worried about the price of the drug. In 2005, a dose cost around $1. Now it's $36. A major drug company says the price increase comes from making, packaging, and shipping, along with insurance issues.